One in 8 women will be diagnosed with breast cancer in her lifetime. Early detection and early treatment are the best hopes for survival. As Lurene Cachola explains, the Breast Risk Management Center at the Baptist Women's Health Center is working to help women at high risk.
People can't know when illness will strike, but they can learn when they're at risk. That includes being at risk of breast cancer. Specialists at the Breast Risk Management Center in the Baptist Women's Health Center can help determine what those risks might be.
I talk with women who are concerned about their breast cancer risk, either because they have a family history or maybe have had biopsies or just aren't certain if they're at increased risk.
When Winter meets with women, she goes over their family history, which can be the key to determine risk. Having a relative who has had breast cancer can increase a woman's risk. So can childbirth early in life or late in life. Other risks include taking hormones or having multiple biopsies, even if they are benign. And of course, genetic mutations also play a role, particularly in the BRCA1 or BRCA2 genes.
It's if there's a change in those genes or a mutation, something that stops that gene from working correctly, that then increases our risk for breast cancer.
There are 3 basic levels of cancer risk. Average is when a person has no major risk factors and no strong family history. That means they have about a 12% lifetime risk for breast cancer. Moderate means a woman possibly has some family history, began menstruation early, and doesn't have children. That carries a 20 to 30% lifetime risk. A high risk is when women have a definite hereditary risk. They can have a 50 to 85% risk of breast cancer in their lifetimes. That risk can be increased by mutations in the BRCA1 or BRCA2 genes. Doctors say mutations in those genes are often responsible for cancer.
So sometimes people think, well, they don't have any choice. They have to go out and do something radical or they're just doomed.
But action can depend on the level of risk. Doctors may recommend increased surveillance, including more intense screenings. Women may be encouraged to use medication to manage their risks. But some may decide that preventative surgery to remove at-risk breast tissue is their safest course of action.
So first of all, we look at what their risk is. If their risk is not because of one of these genetic mutations, so it's somewhere increased over the general population, but lower than if they maybe had a mutation, then we maybe advise increased screening.
Women interested in knowing their own cancer risk can contact the Breast Risk Management Center in the Baptist Women's Health Center at 901-226-0810. For Smart Medicine, I'm Lurene Cachola.